Hi, everyone. Wish you all a very good morning. Thank you so much for coming in such good numbers to attend today's session on brain health. I know this is a topic which impacts all of us, and it's something which we are always worried about, and increasingly so, because I think many of us have experienced or are experiencing, and I think especially during COVID, things started where people started talking about brain fog and issues like that. And increasingly, there is much more awareness about issues like dementia and Alzheimer's and memory loss, some of which can be age related memory loss, but something can be more severe as well. So I think, as they say, knowledge is power. So it's always good to kind of equip ourselves with the right knowledge so that we can take better care of ourselves. I am Nidhi and I am the founder of Silver Talkies. Silver Talkies is a platform for older adults, people above the age of 55. We are a community led platform where our intention is to help and support seniors to age actively, age healthy. So if you are someone who desires to stay active for the longer term and who desires to stay healthy, and if you desire to have company, have a social network, then we strongly recommend that you consider becoming a member of the Silver Talkies Club. Because now, very quickly, I will just introduce our speakers for today. Ramani Sundaram comes with 15 years of experience in dementia and elder care. She is a passionate neuroscientist committed to improving the lives of seniors. She brings deep expertise in neuropsychiatric assessments, personalized care planning, and program leadership, and has designed and led impactful dementia care and active aging initiatives across the country. Her work spans from hands on care to national advocacy, managing grants, driving fundraising, capacity building, shaping policy to ensure high quality, compassionate dementia care. She is currently serving as Executive Director at the Dementia India Alliance. And a hearty welcome and a very warm welcome to you, Ramani. And thank you for accepting this invite to talk to us about this very important topic today.
Thank you,
Joining
Nidhi.
Ramani Joining Ramani is Mino. Mino is a neuro counselor at Ivory. She holds a master's in psychology from the Indian Institute of Psychology and Research. She brings extensive experience in neurodegeneration, genetic influences, and cognitive aspects of major mental illnesses from her tenure at NIMHANS. Now, with over 7 years in the field, her focus lies in neuropsychological assessments, exploring human cognitive abilities, neurodegenerative disorders, neuropsychiatric conditions, and cognitive rehabilitation.
I'm going to talk about why does brain health matter as we age. What has happened worldwide is that people do understand physical health very well because there's so much awareness about medical and physical conditions. But brain health awareness is slowly building worldwide. In India, because we do a lot of advocacy work, awareness work across the country, it is slowly building up. And this is the time that we really need to have conversation around brain health. So when we talk about brain, your brain is who you are. So your memories, the way you have learned about things actually make the person you are. And it is important to ensure that we take right steps to protect our brain as we age. Because as we are aging, there are multiple challenges that we all face. Currently in India, there's such a high load of vascular conditions such as diabetes, hypertension, obesity. In fact, we are leading the world in all of these conditions. And these conditions not just have effect on our physical health, but they also have a very, very strong effect on our brain health as well. And brain health is not just about having a good memory or having a good concentration. It's actually about making most of the efficiency of your brain or being highly proactive, highly independent, even as you age. And it is important to see that we address all the factors which are responsible for your brain health, starting from memory, learning, play, concentration, looking at all the different modules to ensure that we address brain health in a holistic manner. So when we talk about brain, there are very few interesting factors that we need to be aware about. The adult brain weighs about 1.3 kgs, and usually in a condition like dementia, it usually shrinks to about half of its size. And dementia is a condition which usually affects people who are above the age of 60. Now we are, in fact, seeing it much earlier as well. But brain, which is actually located at top of our body, seems to be controlling much of our functions of our body, intellectual functions. So it's a very, very important part of our daily functioning. Though it is only 2% of our body weight, it uses nearly 20% of energy. And it actually helps us in forming our habits. It is important for thinking. It is important for memory. It is important for our day to day functioning. So it is important that we build brain health across lifetime. There was earlier studies which used to say that you can build brain health only up to a certain age, but now we know that brain health could be built across the lifetime. So today I'm going to talk about how you could do it, what are the changes that happen in the brain as you age, and what you can do in order to protect your brain health. So, if you look at aging and cognition, as we age, cognitive abilities change. We are not having the same memory as we used to have when we were 20 or 30. As we age, the memory seems to decline a bit. The speed of processing information seems to decline a bit. I think many of us will agree that we would be going for a walk in the park and we would see someone and we know that person's name, but then we'll have difficulty in really, getting that name across or finding, we are familiarizing ourselves with the faces, but then getting the name is a problem. So these are the kinds of things which actually happen as a result of aging, because the cells in the brain are slowly sort of dying. Usually in dementia, this death is much faster. But as we age also, certain kind of normal degeneration does happen. And it usually affects our visual and verbal memory. Sometimes it also affects our visual spatial abilities, our immediate memory, and ability to name objects. That's the reason as we age, sometimes we have difficulty in recollecting where did we leave maybe our keys, maybe our glasses. We do find difficulty in remembering or paying attention to such information as well. There is also decreased attention as we are listening to conversation. There's multiple information that comes our way. We also seem to have less sort of a power in recalling information which we have learned earlier, more specifically to do with names, dates, and places. So this is something that usually happens as we age normally as well. But sometimes when this goes beyond what is normal, then it needs to be paid attention to. So when we talk about cognitive decline, there's something called as normal cognitive decline, and then there is something called as dementia related cognitive decline, which is not normal. What also happens is it is a process. Someone doesn't get into normal to abnormal just in one jump. There is a long phase, which we call it as a gray zone, wherein people may have signs and symptoms which are a little more than what you should have as you age normally, but it is not as abnormal as somebody could say that you have a problem like dementia. Right? So when we talk about aging and cognition, we see that usually in a not normal kind of a situation, people feel more confused. People tend to get lost. What happens is when you look at a newspaper, you will see that there are advertisements or there are communication about an elderly person going missing. Many times, many of us wonder that why elderly go missing, right? Usually children may go missing because they don't know how to come back home. But why does elderly go missing? Because we also work with the National Elders Helpline, we have found that nearly in 60% of the cases, people have gone missing because they are not able to find their way back home. They've had some serious memory problem. The issue here in India is that many of us do not recognize memory problems or problems with cognition as important as any physical problem to really go to a doctor. Whenever I'm able to give a talk to people in public, I've always asked them that has it happened that you've gone into a room to actually pick a stuff or find something, and once you go into the room you tend to forget, and you really don't know why you came into the room or why you opened the refrigerator to take something, but how seriously do you take that particular problem? For example, if you're going for a walk and you're feeling dizzy, then you immediately want to think, what's wrong with you. You want to check with your doctor if there is a health problem with you. But when you tend to forget, it's really not taken so seriously. So the way we sort of weigh our physical and mental health at present is not really the same. We tend to keep physical health much above our brain health. And the kind of conversation we are having today, it is to say that can we weigh them equally? When cognitive abilities become worse, what happens is that they feel more confused. There are possibility that they may get lost. They may ask the same conversation again and again. Many times we see people around us who would say, have you locked the door? And we would have gone and locked the door, but they will ask the same question again and again. Though for somebody who's sitting across them may think that why is this person repeating the same information, there is a possibility that the person doesn't remember that he asked the question earlier. And they may also have difficulty in managing tasks. What happened in typical Indian household is that as people get older, usually family takes over the tasks of actually managing the kitchen or managing the finances or managing the household duties. So what happens is that many times we are unable to understand whether the elder is not able to do these activities. That's why the transition has happened, or the family has actually taken over the responsibility due to which the elder is not able to do these activities anymore, which leads to delayed diagnosis as well. So these are different things that could happen as the person's cognition gets worse. And when it gets worse to an extent that the person is not able to manage the day to day activities, we reflect on a condition called dementia. Right. So as I was talking about earlier, previously we used to think that neuroplasticity or the development of new connections or new cells only happen up to a certain age. But now, because of research, we know that it can even happen in the later life. There's something called as cognitive reserve that we all possess, which actually we can increase by doing sort of good brain health friendly things in our life to ensure that our cognitive reserve remains or doesn't deplete at a faster rate. But when we do negative things, there is a possibility that the cognitive reserve may go down. So when we talk about brain health, we are talking about what are the different things that one can do to ensure positive neuroplasticity and what one should not be doing in order to ensure that the cognitive reserve doesn't really deplete. So I'm going to talk in detail what you can do to ensure that you work on your cognition in a positive manner in the coming slides. But since most of the people who have joined here must be above the age of 50, I think there is a very, very important condition that we all need to be aware about, and that is dementia. Now, you all must be wondering that why is dementia so important and why we need to talk about it. There are certain statistics that I'll be showing in my slide as we move forward, but we want all of you to know that when we talk about memory loss, as we age, there is some sort of memory loss that is normal for the age, and there is some sort of memory loss that is not normal for the age. But the problem is that there is a very thin line between the both. And sometimes when you miss that particular diagnosis, people are sometimes progressing to a condition called dementia. So, dementia is basically a neurodegenerative condition which affects the brain, and it is progressive and irreversible, which affects the person's ability to function every day. So, all of us have memory loss at some point of our life. Most of us forget because we are doing multiple things at a time. But this is a memory loss which can be really life altering. So, we are talking about forgetting the near and dear ones. We're talking about forgetting things like what you have learned throughout your life course, like brushing, bathing, talking to people, social behavior. So when someone gets dementia, what happens is it tends to affect all these areas of the brain, and it is progressive and irreversible. To put it in a very, very simple terminology, think about a chalk piece. Think about it like a brain, right? And when dementia affects a person's brain, think about you're writing with a chalk piece on the board. What happens when you keep writing with the chalk piece on the board? The size of the chalk piece becomes smaller. So that's what happens to the brain as well. When someone gets dementia, the brain cells are dying and the brain is shrinking, the brain is becoming smaller. And when that is happening, what happens is they tend to bring about symptoms in people who are having this condition. And these symptoms could range from forgetting what is the date day to day to actually forgetting who are your near and dear ones. And as the condition progresses, nearly forgetting what language means, how to speak, how to walk, how to talk. So it can get so worse. And what we need to understand is it's not part of normal aging. So what does it mean? Dementia usually affects people who are above the age of 60, but not everyone above the age of 60 gets dementia. So that's the kind of distinction that we need to remember about. So when we look at warning signs of dementia, these are the 10 warning signs of dementia that Alzheimer's Disease International has put out. If you actually see the warning signs, they are not just about memory, it's about different other aspects of the brain as well. Whenever we go out and talk about dementia and we ask them, what do you think it is? People usually say dementia is memory loss. When you actually confine dementia to just memory loss, what happens is the gravity of the situation is not understood very well. In fact, when we go out and give talks on dementia, people say, oh, it's memory loss. And there are jokes around the room saying that, oh, I forget my spectacles or I forget my keys. One day, I forgot that, I had taken my wife for shopping. I came alone back to home. So that we always tend to treat it in a lighter vein. But forgetting something can be a very, very serious problem. For example, forgetting where you left your keys sometimes might be okay, but forgetting what does key mean, what does lock mean, what does it mean in your day-to-day life is really serious. So, forgetting what does brushing means, what does bathing means, could be viewed very, very seriously. So when we talk about 10 warning signs of dementia, the first one is, of course, memory loss. And when we say memory loss, it is about recent memory loss, what you've forgotten recently, maybe what has happened a couple of weeks back, maybe 1 or 2 months back. We mostly look at recent memory loss. Again, this could be remembered in a very simple terminology. Think about a bookshelf which has got 4 shelves, and think all these are your memories, and you have put books in all the shelves. So when you shake the bookshelf rigorously, the first books to fall will be one on the top. So when dementia actually affects the person, the first memories to be affected are the one right on the top. Those are the recent memory. What was yesterday? What was the date yesterday? What did you eat for breakfast? Whom did you meet a week back? Those kind of things which has transpired in couple of weeks or maybe a month or two that you're unable to remember. What was the last festival that went by? Where were you maybe a couple of months back in your relative's house? Which relative's house you were in? So those are the kind of things that people forget when people have a dementia related memory loss. And this is the time when they need to seek help. People will also have difficulty in performing familiar activities. So, what sort of activities? We are talking about things like driving, we're talking about things like ability to use a remote control, ability to use computer if you are someone who's in computer, or you are someone who are very, very good at cooking, microwaving, and you are having difficulty in doing these tasks, then it is definitely a warning sign that one needs to be watching out. Problems with language, specifically word finding difficulty, that you are able to identify the object but you're not able to name it, or in a conversation you're not able to really find the right word. And if it is happening very frequently, then definitely it's a warning sign. Disorientation to time and place, you're not able to sort of say what is the date or what time of the day it is, or you have confusion with places. Now, when we talk about confusion with places, many of the time, this is the reason that people tend to get lost. And this is when actually the families come to us for help. That a person would have gone out to buy milk and he is taking much longer to come back home because he is unable to recognize the roads or recognize the pathways through which he can reach back home. So if you're having trouble with really directions, you're having trouble with familiar surrounding, then definitely that's a warning sign. Um, Poor judgment or decreased judgment is again one of the warning signs of dementia. Many of you would have heard about cyber fraud, and these are things that usually happen with elders. Many times it's a possibility that it is lack of judgment that has happened also due to cognitive decline. So when a person is having a cognitive decline, they will have difficulty in making decisions such as, should I invest my money here? Should I be giving out so much money to somebody? Should I be making this transaction? Is this safer? So these are different kinds of things which could happen in people who are facing cognitive decline due to dementia. They may not have judgment in terms of, should they be withdrawing so much money and giving it to the house help. Those are the different kinds of things that can become some sort of warning signs in people with dementia in the earlier stage. Also, problem in keeping track of things. They tend to forget where they've kept their things, and they are unable to track their appointment. They are unable to track where they put their jewelry. So these are the different kind of things that could happen, and this could lead to misplacing things and having suspicion on somebody else during the earlier stages of dementia. Because you're unable to recollect where you've kept your things, it may lead to suspicion that somebody else has taken it. So that also could happen. And since all this is happening inside someone's brain who's affected perhaps with dementia, they will have change in mood and behavior because there's a lot of information missing in their head. They may have mood swings. They may have changed behavior. If there was someone who were very extrovert, they may become introvert, or they may become highly suspicious, or there might be delusional behaviors. So this could be something that could happen at the early stages of dementia as well. They could have challenges in understanding visual spatial information. In many, many times, we have also seen that people become socially isolated when they are having this problem, because when they are asking the same question again and again, their social circle seem to tell them that, they are forgetting, and then that makes them socially conscious, and they tend to withdraw themselves from the social circles. So these are the 10 warning signs of dementia. Anyone who is above the age of 55 should actively watch out for all these symptoms, because they tend to warn us that there might be something wrong that is going on in the brain. Many times it may not be dementia also. It could be something treatable, such as vitamin deficiency, anemia. It could be uncorrected vitamin B12 deficiency. It could be electrolyte imbalance. So it is important that when you have these warning signs, you seek out for help, get yourself screened, get yourself tested, so that we know that if there is anything treatable, we are able to address those things. Many of you may have questions. Then how do we differentiate between memory loss due to normal aging or changes due to normal aging versus dementia? We have to understand that when someone is forgetting due to old age, it usually doesn't get worse with time. But when someone is having an issue due to dementia, it's a medical problem and it is going to get worse with time. Usually, aging related memory loss, all of us are going to go through it as we age, but dementia affects certain people who are elderly. Similarly, cognitive decline in aging is more minor. People are able to go on with their day to day activities, but dementia related memory loss is moderate to severe. That means that the person will have difficulty in getting by their day to day functioning. People who have age related memory loss are usually cognizant about things that they are forgetting. But in people with dementia, we usually see lack of insight, that they really are not aware that something is wrong with them. Many times it's reported by the family. So when we talk about aging to dementia-related memory loss, in between there is a very, very important aspect which we call as mild cognitive impairment, wherein there is memory loss that a person is experiencing, either reported by the person or reported by the family. But then when you do tests on them, they may actually score fine. But it is important to follow up these people, because many of them may actually go forward and get dementia, while many of them could also, we are able to work with them in order to ensure that they do not progress, because there are a lot of risk factors that one can address very actively to ensure that we are able to address the conversion from mild cognitive impairment to those getting dementia. Right. So when we talk about dementia, there are multiple stages of dementia. Usually, in early stages of dementia, people are largely independent, and they have one or two cognitive issues, like either they'll have memory problem along with a language issue, or they may have issues with making decisions or difficulty in performing familiar tasks in mostly in more complicated settings, that, for example, using a computer, using a remote. So these are different kinds of things which could happen in the milder stages of dementia. Unfortunately, in an Indian setting, people don't come to us in milder stages of dementia. Family really thinks that it is part of normal aging, and they do not get themselves tested during the milder stages of dementia, due to which people usually come to us in moderate stages of dementia, where the person is unable to do their day to day activities by themselves. For example, there is a particular case that I remember from my clinical practice where I had seen a gentleman who was 65-year-old in a routine screening. And when we screened him, we felt that he is having a memory problem, which is not very worse, but we need to follow him up very closely. So I did tell his son that, come back to us after 6 months so that we can retest him. At that point of time, he was able to do much of his activities independently, but he was having memory lapses in terms of where he has put his key, where he has placed his wallet. He used to lose it very frequently. So we used to tell him that, come back after 6 months because we feel that there is something going on there, which has not progressed to an extent that a treatment needs to start, but come back to us after 6 months. But the family never came back to us for about a couple of years. And when I saw him after 2.5 years, the father had actually gone inside the bathroom to take bath, and he came out of the bathroom completely naked without realizing that he has actually worn his clothes. That's when it actually occurred to the family that there is something serious going on with him. But this was something that has been progressing, and the family thought, okay, maybe it's just part of normal aging and he's just forgetting. He was forgetting that whether he had a breakfast, he was forgetting whether he had his conversation on phone with somebody, but family just thought it's all part and parcel of normal aging. What happens is when people are in the mildest stages of dementia, there are a lot of behavioral problems that can happen. There's a lot of personality change. People can become dependent for their activities of daily living. Usually, they also forget how to have a bath, they forget how to use a brush, they may even forget how to use a toilet. So what happens is people go on diapers, they are unable to indicate that they want to go to the toilet, because if we talk about dementia, it affects all our acquired memory. Whatever we know today of using a toilet or walking or talking, it's all acquired memory. These are memories we are not born with. We actually acquire them throughout our life course. But as dementia progresses, it affects nearly all memories that we have. Remember the bookshelf example that I gave you? As dementia affects the brain, the bookshelf is shaken up much rigorously. So what happens once the top shelf book falls, then the second shelf will fall. So the person will forget what happened maybe 5 to 10 years earlier. If you shake it even further, when dementia progresses even further, they will forget their memories 20, 30 years back as well. So they may not be able to recognize that they are married, they have X number of children. These are things that they tend to forget. And they may even forget as the dementia progresses that how do they use a toilet? What does food mean? Why you should not eat perhaps something like a soap that is lying around, due to which what happens is there's a lot of stress on the family because they cannot leave the elderly person at home alone. They need to be looked after. So people have to leave their job, sit at home and look after somebody with dementia. During the later stages of dementia, usually people are wheelchair bound or bedridden because they've completely forgotten how to walk or how to move around. Many times people are completely silent. They have completely forgotten how to speak to somebody. Language is nearly nil. And during final stages of dementia, people usually forget how to swallow. So that is the stage when we know that it's nearly reached a terminal stages of dementia. So what happens is usually when we give food to a person with dementia during the later stages, they will pocket the food here, here. They're not really swallowing because they don't know how to swallow. And it's very difficult to teach someone swallowing. And that's the stage when people usually go on Riles tube and PEX tube and things like that. So, what happens when somebody is affected with dementia? Usually, there is an effect on their cognitive ability. They're unable to memorize things, they're unable to remember, they have difficulty in concentration, thinking, understanding, solving issues. That's all happening in their head. And as it progresses, they will have difficulty in activities of daily living, such as taking a bath, using a toilet, or being around by themselves. We all have to understand that when it happens to an elderly person, it could really take a toll on their quality of life, because we know that in children, when they are unable to do these things, we know that as they are going to get older, they're going to become independent. They're going to learn all these things. But when someone gets dementia, especially an elderly gets dementia, they're not going to become better. They're going to become worse. So it takes a lot of toll on a person who's affected with dementia as well as their family. And as the disease progresses, there's a lot of physical decline, like gradual decline in health, uh, walking, sleep disturbances, food intake, etc. And as I said, during the moderate stages of dementia, when you have so many gaps in your memory, you are unable to remember. There's a lot of emotional and behavioral issues, such as anxiety. There's a lot of depression. There's a lot of agitation. Those are things that could happen. Many times, these are the reason that people are usually institutionalized. We have known family members wherein, the father who has dementia has actually taken a knife and tried to kill the son because he cannot remember the current son whom he's looking as an adult is actually his son. So those are also different kinds of things that can happen. There's of course loss of interpersonal roles and social relationship, though they have their family around, since they don't recognize faces. And it's very, very difficult on a family caregiver itself, because they have to really take care of all the needs of a person with dementia. They have to take care of their health, they have to take care of their day to day activity, which in turn impacts the health of a family carer, because they have to make all the decisions for their loved one. Though they are elderly, many times, family members have to be very harsh on them, which leads to a lot of guilt. And when you're caring for somebody with dementia, it can take really a social, emotional, and financial toll on the person. I remember a peculiar case wherein a wife had called me for a husband who got a particular type of dementia, which we call as frontotemporal dementia. It actually affects the person in a much younger age group. So her husband was 50 when he got dementia, and the job went to her. The husband's job went to her. She's from a middle class family, and the husband had progressed quite a bit at that point of time, and he was on diaper and all those stuff. During COVID time, both her children who were going to high school were looking after the father. But once COVID pandemic got over, the children had to go back to school, the wife had to go back to job, but she did not have enough to actually employ a home caregiver. And she called us and said, can you help me? Because at present, I'm tying him to a cot with a long rope so that he can move around, and I'll take care of him when I come in the evening. So she used to leave the food and everything around for for her husband to really, sort of eat and all that, and she used to come back in the evening and clean the mess. So these are different. There are different caregiver stories in different section of population. Very heartbreaking when you go to the lower socioeconomic status, because there's not much help available. So for a family caregiver, there is also the impact of really taking care of day-to-day activities of the person, ensuring the person doesn't get lost, taking care of all the tantrum that the person is going through. That's the reason we call dementia as a long goodbye, because you lose the person when they lose memory about you, they forget you, you lose the person. But as the disease progresses, they remain in this stage anywhere between 2 to 12 years. After 12 years, you actually lose the physical body of the person. So we call dementia as a long goodbye, because both the person and the family has to endure this journey anywhere between 2 to 12 years. Right? So why we need to talk about dementia? If you look at latest estimates, there are 7.4% of people affected with dementia above the age of 60. So what does it mean? In 100 people who are above the age of 60, 8 people are likely to get dementia, which is a very, very high number, because we are an aging country. We know that by 2030, we are going to be one of the countries with highest number of older people. So we really, really need to understand what is going to be the impact of dementia, because there's so much that one can do in order to prevent dementia. And this is the time that we really work out on our action items to prevent dementia. If you look at the cost of care for dementia, none of it is covered by insurance. Currently, most of the cost of care is spent by the family. They spend anywhere between 18 to 25,000 per month to look after somebody with dementia. And this is definitely a lower estimate, because if you look at metropolitan city, the cost is much higher. Many of you would have employed a home caregiver for somebody in your family, and you very well know what is the cost of getting a 24/7 help who may not even be trained. So that's the reason we need to talk about it. And one of the biggest challenges that we face in dementia is nearly 90% never get a diagnosis. The reason being that many times it is assumed to be part of normal aging. Right? So there are multitude of challenges that we face when we talk about dementia. There is lack of public awareness. Not many people are aware about dementia. There is fear of diagnosis. In fact, at Dementia India Alliance, we go out in the community and we do proactive memory screening. And many people have come and asked me that why I should get myself screened when I know that there is no treatment for it, why I should get myself screened and know about the condition. So there is a lot of fear of diagnosis, and I'll come why you need to actually get yourself screened. There's lack of public awareness as well. People don't understand dementia. They have a lot of stigma around it. And if somebody has dementia in the family, they think it is mental illness. People are mad. And, those are the kind of terminology that they use. So it is very difficult to sort of, address the stigma at the community level. There's a lot of challenges in finding primary caregiver. Many of you would have used home health caregivers at some point of time, but getting a trained caregiver is a huge challenge. There aren't a lot of facilities available in India to care for people with dementia. We run a national dementia helpline. We get queries from Orissa, Madhya Pradesh, wanting to know where people can go when they have a brain health issue, something like dementia. But we are unable to refer because there are not many services that are available. Also, there is dearth of trained professionals who can address this kind of condition. If you talk about psychiatrists, I think as per the last estimate in India, there are only 9,000 psychiatrists for the whole country. There are about 5 to 6,000 neurologists, geriatrician, even more lesser. We really don't know how many mental health professionals are completely available across India to provide this kind of services to the large number of elderly population that we are going to have. So why community action matters? When we talk about dementia, each of us have a role to play because as maybe in about 15, 20 years, either we will have dementia or we will be caring for somebody with dementia or we will know someone who is having dementia, or our friend or a closer family will be caring for somebody with dementia. So we will be attached to dementia in one way or another. So it is important that at an individual level, dementia affects people. It affects families because the caring is a family's business at the moment, and it allows a lot of load on healthcare system at the community level, and the cost of care is so high that at country level people need to have plans in order to address dementia. It is seventh leading cause of mortality, just ahead of diabetes mellitus, tuberculosis, and kidney issues, and it is one of the fourth highest contributor to neurological diseases in the world. So what we need to understand is that dementia symptom that we pick up at 60 starts much, much ahead, right? So it starts at least 20 to 25 years earlier. So we can work on our habit when we are between 20 to 40. I'm sure that Mino will cover a lot more on it. But what we need to understand is when we talk about dementia, it is a cumulative effect of a lot of risk factors that affect our brain. So we need to ensure that we work very hard between 20 to 40 to ensure that our brain is healthier when we are older. This doesn't mean that you cannot do much when you are older. There are a lot of things that you can do after the age of 60 as well. But then 20 to 40 is a prime window where we can actually work on our brain health actively, right? So, what are the factors that are linked to dementia? There are 14 risk factors that are linked to dementia. And these are the factors which are also associated with, in general, brain health, right? So, if you look at the diagram here, it talks about what are the risk factors that are associated with early life, what are the risk factors that are associated with midlife, and what are the risk factors that are associated with later life. So, if you look at early life, it is education. So, the more educated you are, you're more protected from the risk of dementia. While in midlife, there are multitude of factors that one needs to address. When we talk about midlife, now the definition of midlife has become much broader. Previously, we used to say that, we are talking 18 to 30 or something like that. But then now the definition has become much broader because we have a greater longevity window. So these risk factors applies to anyone who's up till the age of 55 or 60. So we are talking about hearing impairment. Now, many of you who are in this call, of course, when we have a Q&A session, there is something that I would like to ask many of you, that have you got yourself, have you screened your hearing? Because many of us don't do it as part of our regular checkup, but hearing impairment can actually have and a risk towards cognitive decline, because hearing impairment is again something that is usually picked up by others, not by ourselves. So people may say that you're hearing the TV in a very, very loud volume, or people have to speak to you in a much louder volume for you to hear. So in a room, if it's many people are talking, you are having difficulty in catching conversation, then those are risks that you need to be mindfully aware of. So anyone who is above the age of 50 should get a hearing test done, because hearing impairment really contributes to cognitive decline. Then there are these triads of cardiovascular risk factors, which includes your diabetes, hypertension, cholesterol, obesity. Now, what is bad for the heart is bad for the brain. So we need to ensure that we keep all of these in check. In fact, in many, many cultures, in many, many risk journals, dementia is also called as the diabetes of the brain. So sugar, having long-term diabetes, just does not affect your kidney, liver. It also affects your brain. So it is important to take care of diabetes, hypertension, obesity. It's very, very important, especially with hypertension. In many when you go to a physician, if it is 130 by 90, they will say, oh, 120/80 is normal. So 130/90 is perhaps not hypertensive, but it is. It can have an effect on your brain. What we also need to understand is when we talk about dementia, Alzheimer's is something that people are very well aware about, but there are other types of dementia, such as vascular dementia as well, which is mostly due to vascular risk factors. And if you read recent research, 1 in 4 are likely to get stroke because of the high load of vascular risk factors. So we really need to address those when we are going to a doctor. So this triage that works on your cardiovascular health needs to be addressed. Again, another thing would be high cholesterol that needs to be addressed, especially the belly fat that all of us have. It's not more to do with the extreme, it's not about our body weight. It's actually about the fat that you're carrying around your organ. So that is something that we need to be mindful about. Depression is another thing that is very under recognized, especially in elderly population. In fact, depression is way more prominent than dementia in an elderly population. Traumatic brain injury, especially in elderly, if you talk about, they are very much prone to fall, and when they fall, it could lead to brain injury, and that also contributes to a risk factor to dementia. Physical inactivity, consumption of alcohol, and smoking is again something that is a risk factor to your brain. In the later life, it is uncorrected visual impairment. So it is important to correct your vision issues if you have any. Social isolation, I think not having friends, not really going out and talking to somebody can be a huge risk factor for dementia, and air pollution is also one contributing risk factor for dementia. We all know what is happening in Delhi at the moment. So what can you do to reduce the risk of dementia, or in general to keep yourself mentally active, keep your brain health well? You need to remain physically, mentally, and socially active. That is very, very important. When I say socially active, it's not really about being on the phone or being on social media. It's about really having real conversation, making friends, socializing with people is very, very important. Platform like this, what Silver Inning is doing, is definitely one such ways of keeping yourself socially active. Learning new things, learning new language, or learning music, or trying to write a page with your non-dominant hand. So if you're right-handed, try doing writing with your left hand, reading a book, something that you don't usually do. Always remember, if there is something that you're already doing, just doing the same thing again may not be neuroprotective. Usually doing something different really helps your brain a lot. Exercising regularly, exercising, which we mean about 30 minutes at least 4 days a week, is very essential. 120 to 150 minutes of physical exercises a week is important. You can do a mix of aerobic, strength training. It could be yoga, it could be jogging, it could be walking, it could be chair exercises. Many people, when we tell them about physical activity, people who are elderly, they will say, I'm osteoarthritic, or I have a bad knee, so I'm unable to go for a walk. You really don't have to go for a walk outside. You can sit on a chair, do chair walking, chair exercises. They are also highly beneficial. Lifting weights, strength training is very important. As we age, there is frailty, there is muscle loss. So it is important to do weight training. Maybe just pick up 1 liter water bottle and try to do some biceps curls, triceps curls. They can be very, very effective. Yoga is again very, very well documented for strength training. So you can do that as well. Get regular checkups done I'm sure that many of you would be getting a yearly blood test done. If you're getting it done, include parameters like vitamin B12, vitamin D3. They are very important when you're testing yourself, because they also are a contributing factor to cognitive decline. So get that done. Eat a balanced and nutritious meal. Most important is you really don't have to look out for something very fancy. The ideal plate would be having good amount of vegetables, less amount of carb, more proteins. Include nuts. If you're someone who's non-vegetarian, fish is really, really good. They've got omega-3 fatty acids. If you are someone who's vegetarian, go for nuts. They're very good. Go for seeds like pumpkin seeds and other seeds, sunflower seeds that are available. They are very, very good for your brain. Soap nuts are very good. Try to eat your meal by 6:37 at maximum. That is very, very important. It keeps your sugars in check. It keeps your weight in check. So that's very important. Try to do all of that and limit alcohol. Quit smoking. It's very, very important. Smoking does no benefit to your lung, to your heart, or to your brain. So try to do that. Avoid head injury. If you're someone who's prone to fall, do fall prevention exercises, which can be helpful. Wear helmets if you're going on a two-wheeler. That's very important. Be mindful about your hearing. Get a hearing test done. If you have a hearing loss, please use a hearing aid. That's very important. If you live in a polluted city, please use mask. And depression is most often under recognized in elderly, because sometimes there's loss of spouse, there's loss of friend who is in the same age. There are multiple medical conditions that are affecting you. Many elderly people take 15 to 20 pills a day. That itself pulls down their morale. Because of taking so many pills, they're not able to really find the taste of the food, which can lead to a lot of problems. There are financial insecurities. There could be many, many things that could be contributing, which may lead to some depressive symptoms. If you have those symptoms, please reach out to a counselor and talk about it, because depression again can really increase the speed of cognitive decline. So dementia has pervasive societal consequences, and we at Dementia India Alliance try to see how we can look at addressing dementia in a comprehensive manner. So we work across the spectrum: awareness, prevention, curative, promotive, and training. So that's what we do. And what the one message that I really want to leave you with is importance of early detection. So when we are talking about this, it is important to understand that when we are able to detect dementia early, there is so much more that we can do. The person can have a better quality of life. I'm not sure how many of you have known somebody with dementia. It's important when we talk about quality of life, it means that you have the power to make decisions about what you eat, what you wear, what you want to be doing in your day-to-day life. Unfortunately, dementia robs the person of that very decision making. Many of us, if we today sit down and write a living will, which is made legal by the Supreme Court, none of us would be want to be cared for in a vegetative state, or we would want to be cared for in a dignified manner. So we want most of the people to get themselves screened for cognitive decline early, so that we are able to identify brain health related conditions early. And there are so many things that one can do. Don't be scared about screening, because there are so many things that are treatable, could be at play, which could be addressed. There are so many preventive aspects that could be done in order to ensure that people don't progress to dementia completely. I'm sure Mino is going to cover about what she does in Ivory, but with respect to cognitive screening, Dementia India Alliance has a platform called DEM Clinic, where we do free cognitive screening for people. It takes anywhere between 7 to 10 minutes to do the cognitive screening. It's completely free of cost. Any of you can book it at the platform. It is done by a trained mental health professional, either a social worker or a psychologist. They do this screening and it is done within 10 minutes. You can do it online or you can get it done offline if you want. You have an apartment complex, we could come and do community screening. That's the helpline number on the screen. You all could call and book it. As I said, please look at it as doing your blood test every year. Even diabetes is not curable. You all have to understand it's only manageable. And when you do a HbA1c test, they tell you whether you're pre-diabetic or diabetic, and they will tell you you have to do 1, 2, 3, 4, 5 in order to keep your sugars at check. And you have to take medication lifelong in order to address diabetes. And it is also a progressive condition. So try to look at a cognitive decline similar to that. So as you would get proactively tested yourself for diabetes, please get your self-tested for cognitive decline as well. Either you could reach out to Dem Clinic if you want a 5 to 10 minutes quick assessment free of cost, or you can also reach out to Ivory for the cognitive assessment. We work with them as well, a beautiful platform they have also built, which is completely neuroscience backed. So you have both these options to get yourself screened. The important message here is if you are above the age of 55, irrespective whether you have a memory problem or not, getting yourself screened is very, very important. And that's what I want to tell you, that each of us have a role to play in ensuring that we have a better brain health. If you are someone who's in your middle age, it's important that you ensure you do all right things so that you age gracefully with good mental health and brain health. If you're someone who is above the age of 60, there are still so many things that you can do in order to keep your brain health active. And if you know somebody with dementia, if you know somebody who's suffering with memory loss, encourage them to get a diagnosis, be sympathetic and empathetic towards them. Each of you have a role to play, and that's the message that I'm going to leave you with. Thank you very much for listening, and thank you very much for the opportunity.
Thank you so much, Ramani. I would like to invite Mino now to talk to us about cognitive screening that Ivory has to offer.
Hello, everyone. I'm Mino. I'm a clinical psychologist, and I've previously worked in Nimans Hospital, currently associated with Ivory for over a year and a half. I'll quickly take you through our core team. So we have Isaac and Rahul, who are our founding members, along with our clinical team, Dr. Sumati, Dr. Anu from Manipal, Dr. Sid, and Ms. Jwala Narayanan. So we have a team, who is really science-backed, and we are also sit in the intersection of clinical science and digital experience. We have a list of clinical partners and psychologists as well, who was there to back us up in all aspects of what we are doing. So most of what the preventive measures or what dementia is, Ramani ma'am has shared, but I'll quickly just screen through it as well. So why is Ivory doing this? Because cognitive health is quietly becoming one of the biggest blind spots in the modern well-being, right? So we all, like ma'am said, we all track our steps, our sleep, our heart rate, but no one tracks how well their brain is actually functioning, right? So the reality is that 1 in 5 people over the age of 65 already show signs of MCI, that's mild cognitive impairment, and almost 90% of them never get diagnosed until it's too late for a meaningful intervention, right? And this isn't just about getting, about age, but decline begins much earlier. That's in your 40s and your 50s, with things we often dismiss as normal stress or a brain fog. So what research actually shows is that your brain health is the single biggest predictor of your health span. And that's how well you live, not just how long you live, which means that if we can understand and improve our cognitive health much early, we're not just protecting our memory, but we're extending the quality of life, independence, and our identity itself. So what's striking is that cognitive decline doesn't begin in old age, like we already mentioned. It begins 10 to 15 years before we actually notice it. So subtle lapses in memory, focus, or processing speed often signal something called as the accelerated brain aging. That's when the brain starts to slow down much faster than it should. But the good news is that with timely checks and small lifestyle changes, it is possible to slow or even steady this particular decline. So globally, cognitive screening is already part of many mainstream preventive health. Like in the US, Medicare mandates annual cognitive check. In the Singapore, it's integrated into executive health packages. In the UK, it's part of private health evaluation. Yet in India, where we are over 150 million people, about the age of 60, there is no standardized pathway for cognitive screening yet. And that's where, us organizations are trying to fill in the gap as well. So at Ivory, mainly, we are in so that you guys can have an overview of what we are doing. So at Ivory, we use the FDA-registered digital tool. It's built on 17th neuroscience-backed task to detect early signs of cognitive decline. So the test takes about 30 to 40 minutes and it can be done. It's all digital. It can be done at the comfort of your home from a phone or a laptop. And this test has been benchmarked against 1.2 million users globally. So this will give you a clear picture of how your brain is actually performing. That's I'll show you a gist of our report as well. So it gives you a clear picture of across memory, attention, processing speed, motor coordination, etc. And it also flags any early shifts that might point to accelerated aging. So here we also have something called as the health and lifestyle screening as well. In fact, this particular screen which I'm showing now is an additional new package that we have introduced recently called as the Advanced Brain and Health Checkup. It combines, again, detailed blood tests, digital cognitive assessment, and a neurologist consultation. So it gives a complete picture of how your heart and brain are working together. So, in addition to the regular tests that most of us take up in the annual checkups, this particular checkup looks slightly bit more deeper, picking up early signs of inflammation, nutrient changes, and other risk factors that can affect focus, memory, long-term brain health, the ones which Ramani ma'am told, the B12, B3, thyroid, etc. So this would in turn help the neurologist connect the dots and give us a clearer, personalized guidance to protect both our heart and brain. Package which we have specifically for Silver Talkies members, we have this package slash down 25% as well. So I presume Nidhi will be sharing around the information. So if any of you would like to get in touch with us and know more about it before proceeding, that we're open for that as well. So that's mainly what the screening or the preventive measures are mainly what we at Ivory is trying to get more attention with everybody, right?
Ramani, the most common question that I got was asking, is dementia hereditary?
I think, fortunately, not less than 5% is what we understand is hereditary. So if there is a genetic influence with respect to dementia, usually this is very early onset. When there is an early onset dementia, there's usually a genetic component. There are genes that are recognized for genetic dementias, but they are less than 5%. And other dementias are more sporadic. But in your family, if you have known someone who has dementia, then there is a possibility that one would possess a little higher risk compared to someone else who doesn't have a family member with dementia.
So, from a prevention point of view, it's like how you said that how we kind of do preventive test every year for our, for our physical health. You mentioned that a screening is required for brain health as well. Now, what is like between the two tests that you both spoke about, one which IB does, one which DIA does, right? So, what is the required frequency for doing that screening test?
Right. So I'm sure that Mino will talk about her standards of how it is needs to be done. So at Dementia and Alliance, what we would recommend is the preliminary screening. We ask anybody above the age of 55 because I think the Ivory test, one advantage which I also endorse is they even go much younger, which we would really, we want people to go more younger because, as she said, it starts much earlier. But at Dementia and Alliance, we screen people who are above the age of 55. And once we do the screening test, it could take, as I said, we have a shorter screen, longer screen, which is addressed by clinical psychologists or trained social workers. It could take anywhere between 10 minutes to 20 minutes that we do a preliminary screen. And when we are screening people, if we identify that they do not have an issue, then we ask them ideally to come back after about a year. We tell them you come back after a year. And we also do something called as a risk profiling, because if you have high risks, what I said about 14 risk factors, if your cognitive score is normal, there is a possibility that we may ask you to come back after 6 months because your risk is higher. But if the person is scoring positively on the test, then we do a detailed assessment to see if actually there is something going on there. And if they do well on a detailed assessment, then we tell them come back after 3 months. So basically, it will depend on the outcome of the cognitive screening that we are doing. And at Dementia and Alliance, what we have also tried to do, because I think since organization that work across different sections of the community, rural, semi-urban, urban, across India. We have made it free to ensure that anyone get access to the test, because I think Mino also will agree that there's such a huge stigma about taking that one step towards cognitive assessment. In spite of making it free, having to tell you, not many people really come and get cognitive assessment done because they really don't think it is important. To just to cut my question, what it would be is ideally get it done once a year. If you do not have a problem, lower risk factors. If you have high risk factors, get it done once in 6 months. It is safe.
Absolutely. And I would agree with Dr. Ramani. We actually start early as 30s. In fact, corporate screenings also is something what we do, because a lot of people, young people, and starting from the 30s at corporates face brain fog, depression, which goes unnoticed, and because of which they get other, multiple symptoms. And nowadays everybody has a deficiency of B12, B3, which can mimic memory issue like symptoms as well. So, like ma'am said, if the risk factors, when we do a health and lifestyle risk assessment profile along with the family history taking, etc. So, if the risk factor is high, then the follow-up time will be lower. And then if the risk factor is lesser, then the follow-up time would be higher.
Right. Thank you. Now, if from a prevention point of view, if we were to kind of prescribe a protocol that one could follow in terms of daily practices, right? Are there any three best exercises or best practices that you would recommend to anyone? Well, not necessarily older adult, but yeah, since the forum today comprises largely of older adults, what would be those three things that you would ask them to do on a daily basis?
Mino, you want to go first?
Yeah, sure. So I think main thing is being physically active, because being physically active has a direct component of keeping our brain active as well, right? So keep being physically active in turn helps us stay on, the triad which ma'am said. So the hypertension, the cholesterol, the cholesterol, hypertension, and diabetes mellitus, right? It helps us keep these on track as well, along with obesity, right? So it's like if we take care of our physical activities, then these basic things are sort of covered. Most of the time, what people say is they do not have the time frame, right? They do not have that 5 minutes, 10 minutes, right? So we do not suggest people take out that 30 time if they don't have the time frame, right? It can just be as easy as if you are in a home setup, or if you are in a corporate setup, when you get that 5 minutes of break. It can just be going to the washroom and coming back, or it can be just to go to the, to fill your water bottle and come back. It can just be going to the grocery shop and coming back instead of Blinkit, right? These are the small changes that can be gotten into our daily life practice. So I would mainly say physical activities, right? Having cognitive activities a part of your daily routine. So that would again be playing different games. It can be both online and offline. Again, we would suggest a mix of both, because we do not want anybody to rely solely on online, and then that internally affects the visual capacities, right? So a combination of online and offline cognitive activities like playing chess, exploring new activities, pottery, mandala coloring, etc. So physical, cognitive are the main things which I would suggest.
Yeah, thanks, Mino. I think just to picking up from that, from my side, I think, and two very, very important thing additional to what Mino has already said. I think sleep is always underestimated when it comes to its relation with brain health. Sleep is extremely important when it comes to protecting your brain health. It acts as a clearance of all the depositions that are there in the brain. Sleep helps you clear it. It helps you cement your memory, form those memories, and really regenerates your brain. It regenerates your body completely. I think sleep is taken very lightly in today's generation, so I think it is important to sleep well. Even as elders, I think many of the people whom I see here look that they're 60 plus. There might be diabetes because of you which you're getting up for frequent urination and stuff like that, that could affect your quality of sleep. So it is important not just to sleep longer, but it's also important to have a very good quality of sleep. So if you're snoring, or there are issues, you need to understand whether you have sleep apnea, because these are things that are not addressed very, like head on. We don't address these things. Sleep apnea can reduce the amount of oxygen that is flowing to your brain. So it's important to have good 6 to 8 hours of quality sleep. One. Number two, socialize, make friends. It is highly neuroprotective. There is a reason why we are called social beings. We are supposed to have good social circle. And I think that's the reason I said that we love platforms like Silver Talkies, or what Nightingale's Medical Trust does with elder enrichment, because it brings people together. And that is very, very important when it comes to brain. Even physical activity, what Mino said, when you do it individually, there is a certain percentage effect on your brain. But when you walk in a group, it actually increases up to 30%. So it's important that you stay in a group, form a group, and sleep well, additional to what Mino said.
Thank you so much. And I think you've raised a very pertinent point, because in my experience of, running Silver Talkies for so many years, what I have seen works beautifully is the peer group, right? Because once you're surrounded by peer group, the motivation levels and your inspiration goes much higher. Because I can see people in our club who are, say for example, who have been doing yoga regularly, right? They have joined some class which may be happening on our platform or outside, and when they share their progression, they share their achievements. It kind of it has a ripple effect, because it kind of passes on to others. It is very contagious in many ways, right? So in fact, there was a question in here asking that, if a senior is sedentary and refuses to take up physical activity, then what do you do, right? I think having them being a part of a community where there is peer support, there is peer pressure also in some ways to do better for yourself. I think that goes a long way in improving their physical activity levels as well. And of course, the social connection that they develop, and they thrive on that because they found that tribe. So that also goes a long way in keeping them healthy. Definitely. Another question that I would have, like you spoke about sleep. How about nutrition? How critical is that going to be from a brain health point of view? You did talk about various things that one needs to include in their diet, but again, just to kind of recap, what would be your recommendations from a nutritional point of view?
So, what we need to understand is, I think there was an article in Times of India that how heavily carb dependent country we are. So, that's the reason we also have a very high load of diabetes in India, right? Because we are a highly carb driven country. Like, we love our rice, we love our rotis, we really thrive on that, right? So when we talk about diet, as I said, if you give a recommendation on diet that is, completely exotic and stuff like that, usually it is not something people can do on a long term basis. We have to give something that is very, very simple. So the idea here is that get your rotis, get your rice, nothing wrong, and you need those carbohydrates, but limit the quantity of carbohydrate that you're trying to take. Equalize it with the amount of protein that you're taking. I think protein is very, very important for your body. It's very important for your muscle. And work on micronutrients. You need those micronutrients for your brain. So you need your omega-3 fatty acids, you need your micronutrients for your brain. So it is important. Ideally, when somebody asks me, can you give me what I can have for breakfast, lunch, and dinner? Usually there's a very, very simple thing. When you get up in the morning, first and foremost, you need to hydrate yourself very well. So drink that one full glass of water. With lime, without lime, there are contentions whether it works, it doesn't work. So I'm not even getting into it, but you need to hydrate your body. So have a good glass of water in the morning. You can soak it methi seeds, you want ajwain, jeera, anything. All of it is good gut stimulants. You can have it with anything. So have good glass of water in the morning. a tablespoon of ghee or coconut oil really helps. It cleanses your gut. You can really, really try that. Have a good quality of ghee or good quality coconut oil. I think virgin quality coconut oil. 1 spoon of that. It's good fats. It's good to have early in the morning. You can have that. For breakfast, try to have something which has got fiber and protein. As you age, your body needs fiber. Otherwise, you feel constipated. So have something that is fibrous in the morning. Eggs, if you could include, they're a good rich source of protein. Oats are good. Oats upmas, your regular idlis, they're all very good, which is light on your stomach, but include protein. Have your sambar, have your paneer or have your eggs in the morning, which is protein. Include them as per your convenience. You can have your upmas, but ensure that you have your protein. If you're taking upmas, go with dalia, which has got high fibrous content. That's usually very nice. Or go with something which is lighter like poha. They're very, very good. Add some peanuts to it. They're good for your body. They bring in, good amount of nutrient. Don't have it if you have thyroid. They're advised against it. So have that in the morning. Have soap nuts along with it. They bring your micronutrients with it. So do that. Have a snack in between. It could be a fruit. Ideally, a fruit is good because they keep you fuller. The sugar craving is controlled. As you age, sugar craving goes up. So they usually keep that in check. Include things like pomegranate, mostly colored food. Have pomegranates, have guava. That are natural to our environment. Have those things which are natural to our environment. Go for seasonal fruits. They are very good for your health. So that is important. In the afternoon, try to have, if you're taking 1 cup of rice, have 1 cup of dal, 1 cup of sabzi to, how much carbs you're taking, try to have that. Have uncooked salad as well along with the food, cucumbers, carrots, whatever works for you. For the evening snack, try to have sprouted moong dal. Sprouts are very, very rich in fiber, good for your brain as well. You can go for that. And for night, as I said, have light dinner. Usually you should have a large breakfast, smaller lunch, even smaller dinner. So try to go out for that. Go for something which is natural for you. Bajra, jowar, and all of that are very, very good. They've got good fiber content, good protein. Go for that. Have your idlis, dosas, whatever in limitation. Try to finish your food by 7 o'clock. You really don't have to try anything fancy. As I said, include seeds. Your sunflower seeds, all those seeds that are available in the market. Have them. They are good for your health. So stick to clean diet, home cooked food at regular intervals. Hydration is equally important. Please have your 8 to 10 glasses of water a day. Try to have all that water before 7 o'clock so that you don't get up in the night frequently. So that's what we would advise. Cut caffeine if possible after 5 o'clock. That's pretty much what you need to have.
Awesome. Thank you so much. I think we did cover this very extensively, but I think one of the most common confusions that one has, like there's a question here that sometimes due to attention deficit, a person may exhibit repetitive questioning. Now, how do you differentiate those signs vis-a-vis whether it's a symptom for dementia? So is there any,
would you like to take?
is there any clear line between the two?
Right. So like ma'am said, dementia, or the clear line or bifurcation between the two is how often or the frequency or on what situations or instances does this happen, right? So when it is, subjective impairment, right? Many people do mention this, that they do have attention deficits. They are not able to keep a track of where have they kept those keys, or have they put out the stove or not. Cut to, is this a dementia symptom or not, is basically how do we track it is we do ask them to keep a note of on when are these situations that they are noticing, right? Ideally, if this happens very often, or if it is noticeable to the family members, right? Or if it is very evident to themselves itself. How often does it happen? Is it impairing any of their daily life activities? So that's where the line comes, where is, if it is dementia or an early symptom of dementia, or if it is just attention deficit per se. So if it is attention deficits, then with few changes in recommendations, they should be able to get over these tasks, right? If it is not, and if it is continuing in the similar way, then that is something which we have to screen and look for other symptoms as well. And definitely it will not come with one particular symptom. It'll be coming along with a combination of symptoms per se as well. So that's one way of seeing if it is something which is only attention deficit, or if it's in combination with other symptoms, which would eventually lead to a symptom of dementia per se.
Right. Another question which came in was that are there any ways to slower the clock for progression from mild stage dementia to a moderate to a severe? Are there any clinical interventions or lifestyle interventions which are available?
Yeah, absolutely. I think that's the reason we keep telling that we want people to come in the milder stages of the condition, because there's so much more that one can do. When we say dementia doesn't have cure, doesn't really mean that there's nothing that one can do. There's so many things that one can do, especially when people come in milder stages of dementia. We try to advise them with a very good care plan, right? So we can tell them that how they need to keep them physically active, how do they engage in cognitive exercises, what are the different medications that could be started in the earlier stages of dementia, because these medications can actually slow down the progression of the condition. It won't halt it, but it will definitely slow down the condition. So there are proven ways that one can actually slow down the progression from mild to moderate if you actually put them through a good care plan, which is a good routine, and people are physically, cognitively, socially active, and medical conditions are taken care well with certain pharmacological intervention. It is very much possible. And if you continue that, though activities may change based on the abilities that the person is losing, but you need to keep that constant across the spectrum of dementia, whether they are in mild stages, whether they are in moderate stages, whether they are in severe stages. Even in moderate stages, there are many things that people can still do. It's all about ensuring that that level of autonomy and independence is given to the client so that they remain active.
I'm just curious, I maybe say if I am 60 or 60 plus today, and I seem to have no memory related issues so far, and whatever signs that I may be witnessing are very common and can, like how you said, I've forgotten what I went to the kitchen for, right? Those kind of smaller signs. What is the likelihood that I may still get dementia with advancing age? And is there a way to kind of stop that from happening?
It's a very interesting question. The answer is, though not very simple, I'll try to answer it in two parts, right? Age is one of the highest risk factor for dementia. So anyone who's aging is at the risk of dementia. So every one of us are at the risk of dementia as we are aging. The longer you live, as you age more. So if your risk when you're 60 is 20%, when you're 80, it goes up to 40%. You live longer, the risk keeps rising. So each one of us are at the risk of cognitive impairment. So it is important that we are proactive in screening, like each one of us at the risk of diabetes today. Full stop. We are all at the risk of diabetes. So we need to get ourselves proactively screened, irrespective whether you have the symptoms or not. And I think that's why a platform like Ivory or what we are doing at DEM Clinic, that's the kind of an action that we are talking about. So that needs to be done. Number two is when we are able to screen people with dementia, there is a lot of hopeful literature out there, proven facts that dementia can be prevented or slowed down or mitigated by up to, if you look at Indian literature, since there is a high vascular load, we can reduce dementia incidence by 60% if you address those lifestyle risk factors. So the hopeful message here is that there is so much that you can do. So rather than concentrating on that X number is not treatable, there's 60% that you can do something about. So the action here would be do that 60% so that you don't end up getting dementia.
So would it be a safe thing to say that, say for example, a community platform like Silver Talkies, which is open to people who are above the age of 55, which provides some of the things that you mentioned, right? The physical activity, the social connection, the learning new, the lifelong learning opportunities and stuff like that. So if someone were to, become a part of a community platform like that, then there is a better chance of their brains being more active. Hence, the cognitive decline is likely to kind of slow down, and hence the risk of getting dementia or something similar is likely to reduce.
So platform like Silver Talkies or the active aging platforms that many people are running, we usually club them inside the risk reduction programs. ideally, I would call what you are doing a risk reduction program because you are actually addressing multiple facets, right? So when we talk about WHO definition of healthy aging, it says that when you are able to be physically active, mentally active, socially active, and you are now the new definition is digitally active. So you even have awareness about the digital space, and through the digital space, you are able to absorb information. Since you are sort of doing all the four pillars of the WHO, of course, you are an active aging platform. And if you have to go a little further, you are, of course, a dementia risk reduction platform. I think that what we all don't do is we don't record it in a certain manner because it's not organized in a dementia risk reduction schedule, right? Because when we talk about a dementia risk reduction schedule, there is an X number of hours of physical activity that one has to get in order to show a scientifically that so much percentage has improved. But platform like this, though there is no maybe not a very research oriented structured approach, you in your way are definitely contributing to dementia risk reduction and a healthy aging society.
Thank you. Thank you for sharing that. In your experience of conducting these screenings, has there been, what has been the lowest age category where you have actually found somebody who has shown a visible sign of cognitive decline?
Right. Like I said, we do start off screening from the age of 25, actually. So, in fact, people, even though we have openly told them that, only if you have some certain issues which you'd like to discuss is when you have to take the screening. Sometimes what happens is people do come in combination with other mental health issues as well, which sort of, gives a backhand to their cognitive issues, right? So, in terms of bringing a symptom sort of a profile which we have found is in our 50s actually. So yeah, that's the spot which we have sort of seen our clients where we have to refer them to a neurologist or a neuropsychologist for deeper evaluation first. Because what we also have currently is a general cognitive screener. So we might not be able to tap on that particular thing. We might have to um, um, uh, guide them to a neuropsychologist who does much more intensive evaluation.
Okay. Ramani, I'll just take one couple of last questions, and I would kind of these are from the caregivers who are in the house who have people, with dementia that they're caring for. One question which came in was, why do people with dementia have a craving for sugar? Is there any scientific reason for it?
Well, I don't think that it is only people with dementia who have craving for sugar. That isn't true. The problem is that most elderly people do have, those cravings for sugar, especially if you're someone who has been diabetic for a very long time and sugars have not been shown to you for at your household. Those cravings are obvious. Many of us have post lunch sugar craving or post food sugar craving. It's quite normal to have that. But in persons with dementia, what happens is since that understanding that rational thinking is not there, that is not good for me, they may express the sugar craving very verbally and they may really want to have that, right? So that's a possibility that they may have sugar craving. But one advice that I usually give to family caregivers, because I'm also a family caregiver, what I give is that there is only so much time that they're going to remember the taste. They will forget the taste eventually. So if they would want that one piece of sweet after food, if it doesn't hurt much, give them that when they are able to relish the taste. It doesn't really hurt.
Fair point. Thank you. Thank you. Any tips or anything that you would like to tell the caregivers in the house on what can they do for themselves and what can they do for for the people that they the beneficiaries of their care? Is there anything that you would like to tell them?
So there are like only 4 or 5 tips that we usually give to any family caregiver who's caring for persons with dementia. Number one is you cannot care for somebody if you're not caring for yourself. So it's very important that you care for yourself. In a society like India, much of the caregiver burden falls on the women of the house. It's just assumed that women are born for caregiving, so, they have to do the household, they have to do the work, they also have to do the caregiving. Try to share the load. That's very, very important. We do it quietly, thinking it is part and parcel of my role. I'm somebody's son, I'm somebody's daughter, I'm somebody's wife, I'm somebody's daughter in law. So it is my duty to care for that person. Yes, to a certain extent, it's your duty. But when it's going beyond that you can handle, it's absolutely nothing criminal to ask for help. Never be just one primary caregiver who's caring for the person. Try to have help, try to get those breaks. They are life-saving when it comes to caring for somebody with dementia. So that's number one tip that we would like to give. Number two, try to reach out to family caregivers who are also caregiving. Try to be part of support group. For example, Dementia India Alliance runs a support group network which has 1,000+ family caregivers. Try to be part of support group, because you find mutual strength, you find solutions. See, Mino or I may have seen about 1,000, 2,000 cases in our life. When you bring family caregivers, they've lived through so many years of caring for somebody with dementia. Many times we may not have the solution, they will have. So it is important to be part of a family caregiver network. The third point would be, when I speak to family caregivers, when I ask them, introduce yourself, they will say, I am a caregiver. In no other condition that your identity merges with caregiving. You are you. Retain your identity, follow your passion, do your hobbies, have your friends, take care of your life as well. That's very, very important. Fourth, which is equally important to the caregiver and to the care receiver, is manage expectation. The caregiver should manage expectation. The person is not going to be what they were earlier. If they're not taking bath every day, it's okay to let it go. Let them have bath 2 days a week. It's all right. If they're wearing their clothes upside down, it's okay. Don't make it a struggle. It is important to let go of few things, make those compromises so that the life is peaceful for you and for the person with dementia, because they're not going to get better. And fifth and foremost, that my professor taught me when I was doing my neuroscience, especially in neurodegenerative condition, is when you're caring for somebody dementia, always plan for the worst, but hope for the best.
So well said. Thank you. And I'm sure, we do always talk about caring for oneself when you're a caregiver, but people who are in that boat, sailing in that boat, must be really struggling to find that time for themselves, but understandably so. But yeah, I think it's just the small efforts which count, right? One more question which has come in after, as fallout of the discussion that we were having. Somebody has asked, like, how often, or in a week, is a community interaction ideal?
Mino, please.
Yeah. I mean, there's definitely no specific, number of times per se. It definitely depends on everybody, each person, right? Again, it depends on age groups per se. Like if it's corporate people or people in their 30s, 40s, they might not be able to, go interact with their peers on a regular basis, right? On a daily basis with their friends and family. Ideally, at least once in 2 weeks, definitely. And it always does not have to be, like ma'am said, it's not about going on social media or seeing what's happening wired digitally, but it's about making those connections where you physically meet the people. So I believe at least once in a month, twice in a month. Yeah, again, it's not a norm per se, but try to make it at least that much.
I think more the better. More is always better,
Always
but
better.
at least try to do the bare minimum. I think that's what it is.
Wonderful. Okay, the last question that I will take in the interest of time, we have held you back for a longer time. Between an audiobook and physical reading, which is better for the brain? Because in earlier times, knowledge was percolated through hearing, hence the question.
See, book reading involves much more skills than an audiobook. So that is there, right? You're engaging your visual senses when you're actually reading a book. There's that activity of envisioning those words and making sense of them, and, all of that. Having said that, if you really have to scientifically, work out, which is better, I think both are equally beneficial, whether you're listening to an audiobook or you're reading a book. But I think since the habit of book reading is dying, I'll go by, please pick up a book and read.
Fair enough. All right. So thank you so much, everyone. I know there would be a lot more questions which will keep coming up. How can caregivers engage with Silver Talkies? Funny, we have a caregiver support group for people with dementia, and also for caregivers, general caregivers who may not have people with dementia, and also a caregiver group for passive carers like myself who do not have an active caregiving responsibility, but we do want have sometimes questions on our mind for our parents. So if any one of you is interested in being part of these caregiver support groups, you can drop us an email at connect@silvertalkies.com, and we will add you to these WhatsApp groups. I have found them very useful because we do have the caregivers asking questions to each other and getting inputs, which I think they find very useful. So I am a big advocate of the caregiver support groups because I have seen them live in action, and they definitely are a release of support and hope for those who are doing the very difficult and tough task of caregiving. So thank you so much, Ramani, and I'm looking forward to our continued association. This was our first session in this series, so thank you so much. We will plan again, and thank you, Mino, as always, for being here. We are really very proud of our association with Ivory, and we look forward to continuing that. Thank you so much.
Absolutely.